my name is Fiona Phillips, and I am the nurse manager up in Women's Services, and today we're going to talk about neonatal early onset sepsis calculator and how to use it. And I have Tara, she's the labor and delivery manager, and Amber, who's the Women's Services director with me. All right, so the learning objectives for today are to list which information from the mom's record determines a baby's sepsis risk level, to demonstrate how to access the sepsis calculator on your computer, and to demonstrate the correct use of the sepsis calculator in 3 case studies. So why does labor and delivery need to know this? Great question. Mothers are often diagnosed with chorioamnionitis or chorio prior to delivery, and then they frequently turn to the L&D nurses and say, what does this mean, and what does this mean for my baby? So now you as a labor and delivery nurse could use a sepsis calculator to get a baseline risk level for the infant. So this can help you prepare the mother for a NICU admission if the risk level is really high. So, and special note, even if you put the risk level into the computer and it shows low, don't promise the mom that that doesn't mean a NICU admission, because it all is based on the baby's symptoms as well. So what information do you need in order to run the calculator? You need the baby's gestational age, the highest maternal antepartum temperature, how long the membranes have been ruptured in hours, the maternal GBS status, and then the type of intrapartum antibiotics the mom has received. So, because I know that you guys learn the same way I do, which is to touch, feel, and do, we're going to actually run through a couple case studies, and we'll actually have you put the risk levels into the calculator and see what you think. So, before you put everything into the calculator on each of these, I'm going to just have you guess what you think the risk level would be based on your experience. Okay? All right, so let's practice. So Jenny is a G1P0 who came in 26 hours ago for SROM. She's 38 and 2 weeks today. Jenny's been ruled a failed induction and is getting prepped for a C-section. Her highest temperature was 99 degrees and she's GBS unknown. She received broad spectrum antibiotics for the last 12 hours. What do you think Jenny's baby's risk of GBS sepsis is?
I'm gonna say still low risk.
Low risk?
I'm going to say low to moderate.
Okay, so we will go into our sepsis calculator, which is on your home page of your intranet. And if you scroll down, you'll see this cute little baby picture.
How did we get so lucky?
And we'll click on that to open our calculator. Okay, so first things first, the incidence of early onset sepsis, we're always going to use the CDC guidance. So it's that 0.5 to 1,000 live births.
Point CDC. Okay, point
Yep.
5.
All right, and then we'll go through and just fill out the mom's risk factors. So she's 38 and 2. Her highest temperature was 99. She's been ruptured 26 hours. Thank you. GBS was unknown, and she received broad spectrum antibiotics for the last 12 hours. And then you'll hit that blue calculate button. And you will see you guys were correct. She is a low risk. So if this baby's well appearing, then baby gets to stay with mom. And that means baby's not symptomatic at all. So theoretically, this mom should get to keep her baby in the room with her. Okay?
Yeah.
So next case study. Let's see. So Sarah is a G2P1 with a macrosomic baby who wants to deliver vaginally. She was brought in for an induction at 37 weeks and her water broke 19 hours ago. Sarah's fever reached 103 and her OB has decided to section her. She's GBS positive but refused antibiotics. What do you think Sarah's baby's risk of GBS sepsis is?
Hi.
She's super
All
high.
right. So we'll put her in. 37. And 103 is her temperature. She was ruptured for 19 hours. Positive GBS status and no antibiotics.
Sounds like a terrible disaster.
Yes.
Oh yeah.
So you can see her risk factors and risk level for her baby are very high. So poor little Sarah, you can help prepare her that after her baby is born, the baby will be going to NICU. Regardless of whether it's symptomatic or not, it needs to at least go to NICU and have a blood culture and likely antibiotics started. So,
okay.
All right. And then our last case study, Miss Maria is 23 years old, G3P2, who arrived fully dilated in labor, ready to push. She's 39 and 3 weeks, GBS positive. Her temperature was 101.5. She reports her water breaking 4 hours ago at home, but there was no time to administer antibiotics prior to delivery. What do you think Maria's baby's risk of GBS sepsis is?
Moderate, maybe? I don't know. She
Yeah,
has a high
it's
temp,
temp.
and she's positive with no antibiotics, but
Yeah.
short rupture, I don't know. Middle of the road, maybe, is my guess. I don't know. What do you
Okay.
think?
I'm with her.
Okay. So this one would be one where, when she's asking you, what does this mean? You'd be like,
I'm not really sure. We'll have to see how the baby looks.
Yep. So 101.5, a rupture time of 4 hours.
GBS positive.
GBS positive,
And no antibiotics.
and no time for antibiotics. So you are correct. She's kind of one of these middle of the road. Even if the baby's appearing well, the baby might still come in for a brief evaluation. There's a chance the baby can come back out to the room with her, which would be great. But if the baby does anything even remotely symptomatic, the baby's staying in the NICU.
Okay.
So Maria's one that we would like to prepare for a decent chance that the baby might have to be in the NICU. So moving forward, now as the mom's labor and delivery nurse, you can help prepare her after a diagnosis of choreo. So you enter the mom's risk factors into our sepsis calculator to determine the baby's baseline risk. And then just keep in mind again, even if the risk factors are low, that the baby's clinical presentation matters. So if the baby's symptomatic at all, even if the risk factors are low, that baby still might be coming to the NICU. But at least for these babies with a really high risk level, like Sarah, you can tell her and prepare her for a NICU admission. Okay?
Great.
Does that make sense?
Yes,
Makes
thank you.
perfect sense.
All right.